And welcome to the Dr. Bob Show. Almost everybody knows somebody that has Alzheimer's. But once the diagnosis is made, what do you do with the patient? What is available for the patient? Do you tell people that surround them about that? How do you take care of the early stages, the middle stages, the later stages? We'll be answering those questions on this show. My guest is Dr. Monica Crane. Dr. Crane is board certified in geriatrics, trained at the University of Pennsylvania, and is the head of the Genesis Neuroscience Clinic in Knoxville, Tennessee. She'll be answering our questions. A lot of good information for you. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about that old problem, snoring, what we can do about it. There's lots of new things that we can do to help prevent snoring. And rotator cuff problems. Does it always need surgery? Can physical therapy work? Do we have to end up going to see the orthopedic doctor? We'll answer those questions. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Monica Crane, board certified in geriatrics, trained at the University of Pennsylvania, the head of Genesis Neuroscience Clinic in Knoxville, Tennessee. Monica, welcome to the Dr. Bob Show.
Well, thank you, Dr. Overholt, for having me back. Third time's a charm.
Yeah, third time's a charm, and you are such a good teacher. So let's talk about, we've talked in the past about making the diagnosis. Once the diagnosis is made, once the patient and the family knows that there's a diagnosis, how do you handle that? It must be terrifying to somebody.
I think hearing a diagnosis is filled with shock and relief. I've had families tell me afterwards that aside from you have Alzheimer's, they heard nothing else. They said, maybe you told us what the treatment was, but we heard nothing.
Except you've got Alzheimer's. So do they deny it? Do they say
I think that it's such a shocking thing. I think it is so shocking to hear those words that it leaves people in a state of what's next.
So what is next? Do you let them settle down and come back a week later, or do you start talking then about, you know, it's there, but we've got lots of things. So how do you talk to that patient?
I think it's important to at least share that, yes, there's hope. I don't believe there's ever a situation without hope. Hope is so important. And I think the attitude is also important, so that if you can find a glimmer of hope and positivity, people do much better, and there's always something to treat. So yes, it's very difficult. Many times spouses in particular are relieved to hear that something is actually wrong, because many times, particularly with mild or early stage disease, no one else sees a problem, and sometimes I see a spouse filled with self-doubt, like maybe I'm making this up. Yeah. Maybe it's just me. Maybe I'm the one that is losing my mind. Yeah,
and so so it's a sigh of relief, but then they say, uh-oh, I've got to be able to do something. So how do you plan those early stages for the caregiver, the spouse, and the person that's got the disease?
Well, I think at that first visit, it's hard to really take it all in. So usually we try to bring families back to talk again. But the key is to give families an opportunity to ask lots of questions and make sure you write down your questions, because it's all the little things. I think a lot of people want to know, well, how long do I have to live? Yeah. That's a loaded question.
Sure is. And how do you answer that initially? Just say it's a progressive disease and we don't know?
Really, we don't answer at that first visit because we don't know.
Yeah.
Every case is an individual. Every person's an individual, and their outcome is different. So I've learned over time that we're pretty terrible at prediction.
So if we're terrible at predictions, but we know we've got the disease, do you tell them, you're going to have some assistance, but you can carry on a normal life? We'll help you with word problems early. How do you direct the patient in that early phase?
In the early phase, one is still able to do. And we encourage individuals, let's say if you're still working and doing quite fine at your job, to maybe pull back in new areas, but it doesn't mean you should stop being a person. We also try to tell patients that they are still people. They are not defined by this illness.
So you can go to church, you can go to social meetings, you can go to your regular work meetings. Can you work?
It depends. I think it depends on the type of work. But again, we try to set up a plan for retirement, particularly in high-risk jobs. I think if you're in a very high-risk job, sometimes we talk about more immediate work cessation. But I think the really sensitive area is, what do I do? Do I tell my family and friends? And unfortunately, there still is a stigma. Some people hear Alzheimer's and think, wow, you don't understand anything, and they judge. There are others that actually pull away from couples in particular. I had a family today that said there's a lot of isolation, and she feels alone because everything that they did as a couple, they're not able to do. She said, it's like being a single woman, but I'm not.
So the caregiver, the
Yes.
spouse, then has to direct activities. What happens if the patient is having word surge, or they're finding themselves someplace where they didn't know? How do you protect that person? What does the caregiver do?
I think every caregiver is a little different. Sometimes finding ways around it, a workaround, is really important. Many times you'll see a spouse jump right in when there is a word finding problem rather than letting someone struggle. And sometimes I think that that is a better idea, particularly in a social setting where there's a lot of stress to answer something quickly. It's okay to jump in. You're not going to make the word problem worse by answering for your spouse or your loved one.
So the patient that knows they've got Alzheimer's and the caregiver knows they've got Alzheimer's know that sometimes word searching is a normal thing, but it's abnormal in their case. Are there key things that you can do? Should the caregiver interrupt and take over the conversation? How do you handle that?
I think sometimes it's better to help out and sometimes not. Sometimes someone just needs a little more time to answer the question, and it takes a good dose of patience. But at the same time, we have to remember that caregivers are feeling a sense of loss. There's tremendous feeling of loss, particularly with a life partner. If your spouse is now experiencing difficulties, you'll see a spouse that is taking over many other areas in household activities, like the bill paying. Maybe particularly wives that have never ever done this before are now having to assume this responsibility. It's a heavy burden. So we have to be pretty careful with caregivers and not give them too many tasks.
So what about brushing our teeth? What about going to the bathroom? How about hygiene? How about dressing? How about coordinating our clothes? In early disease, is that a problem? Do we have to set clothes out? Do we have to help somebody dress?
Generally not. I think generally you're still able to do,
yes,
especially with things part of a routine. I think if those that are routine oriented actually preserve those activities of daily living until very, very late stages. So being a routine oriented person is wonderful.
So yes, and how long does that phase frequently last? A year, 6 months? Again, it's unpredictable and individualized?
I find that those that have carried a very specific lifelong routine will preserve that until fairly advanced stage.
Oh, good. So if somebody is used to doing normal activities, they can do pretty good.
Yes, those that are used to getting up every morning, taking a shower, brushing their teeth, getting dressed, going to work, generally maintain that.
Driving?
Well, driving is variable. Again, in early disease, you're actually able to drive. I actually looked up the statistic. The accident rate is quite low with those that have very mild disease.
So
much lower than that of those that have intact cognition. So
that would be like me, intact
yes,
cognition, but
correct.
a terrible driver sometimes.
Yes, we find that those that, well, I won't judge your driving, but there are those that, that are experiencing early impairment will actually not multitask. So they generally are not on the cell phone and driving, it's just focused driving. However, if you look at the type of accidents, if you do get into an accident with early stage Alzheimer's, it is going to be traumatic. So the trauma level is much higher, even though the incidence of accidents much lower.
The caregiver, the spouse, the person that's taking care, are they afraid to let somebody go out of the house to drive? Is there a fear of that, or is there a fear they'd get lost?
Yes, yes, it is.
So as it progresses, are there other things we can do in middle stage?
In the middle stage,
And that's what we're going to be talking about. So we've got information on the early stage. Hope is always there. You can carry on normal activities. You may not be functioning as well. Now we're going to, as the disease progresses, we're going to find out what we need to do to help that patient. We're talking with Dr. Monica Crane, board certified in geriatrics, trained at the University of Pennsylvania, the head of Genesis Neuroscience in Knoxville, Tennessee. We've talked about the diagnosis is established. Suddenly we know we have Alzheimer's. So you've got a caregiver, you've got the patient. It's new thoughts, new fears, new direction. The one word we've got is hope. Because there's lots of things you can still do at this age. You're still very functional. You just have early stages of Alzheimer's. And that has to be guided. As things progress, and this is a progressive neurodegenerative disease, then we're going to get into the middle phase. What's the middle phase like, Monica?
The middle phase is the most challenging phase, particularly for caregivers. They've already dealt with the diagnosis, accepted the diagnosis, and this is the stage that requires so much care. And this is a stage that can be isolating because a patient is still able to get out and about, still talking, still walking, and may have preserved activities of daily living, still perhaps uses the bathroom by themselves, etc. And now they require a lot of day-to-day care, maybe in dressing, maybe in just doing simple activities.
Being with the patient, arm in arm, not letting them go out by themselves, middle stage, as it progresses?
Yes, I think that you see more wandering at this phase, and that can be really frightening for a caregiver. So what resources are available? Can you get a safe return bracelet? Knox County Sheriff's Department has free bracelets that have a tracking device on it. There are other different types of phone watches that have GPS. Trying to look into some of those options, really helpful. Maybe wearing a medical alert bracelet as well is helpful.
So how do you guide? Somebody has to have professional guidance to know where those things are. So family doctor or somebody that's trained in people with Alzheimer's, and like yourself.
Yeah, so a lot of times families will come and ask specific questions with myself or my nurse practitioner team about what can we do, what are the resources available, and the actual entire staff is aware of the different resources. Alzheimer's Tennessee has various support groups around the community throughout the counties.
Are those helpful support groups?
Absolutely, because sometimes you feel like, well, you know, I don't need that. But then you realize you're alone. You can't continue to talk to your friends and family that maybe not have an understanding of the disease. So finding others that are experiencing similar difficulties is important.
It makes you feel like you're not the only one with that problem when you get in a support group. So as it progresses, are you worried about maybe them forgetting the bracelet, not being able to be found, not being able to do what activities as it progresses? How bad does it get?
It can get very difficult. Imagine having to bathe and dress your spouse. It is really personal, and there's a deep sense of loss at this phase.
Do people require help? You know,
yes.
Instead of bathing, you know, it's really, when you get down to it, you've lived with your spouse. No, you could do the bathing, but that would be different, you know, different from my standpoint, different certainly from my wife's standpoint. So you have to teach them to do that. How about, do you have to brush your teeth?
A lot of times there are reminders, or maybe even if someone's able to, that's great, but it's a lot of hands-on, one-on-one, going through every single activity, and that can be really tiresome if you're trying to manage a household. So trying to find help, what other resources are there? What about getting a professional paid caregiver that can assist and give you a little time off?
So there are caregivers that will come in for 4 hours or 6 hours?
Correct.
And let the caregiver have some freedom of expression, a little bit.
And I say that sometimes people feel tremendously guilty for taking a few hours off. I had one family that said, I have the caregiver come in once a week, and she feels like that's excessive. And I said, 4 hours with all of the hours in a week, that's all you're asking for? It's not enough, actually.
And so you need more. If Does insurance cover that sometimes, or is that usually out of the family budget?
It is a family budget if you have long-term care. There's also adult day programs that are throughout the community that are wonderful.
Oh, give me an example of one or two daycare facilities. Are there any that you're aware of right now?
For instance, there's a program called the CADES program, and there's another one that is at Trinity. So there are a couple of different programs, and a lot of them are at different churches around the community.
Yeah.
Concord. So it is a place where you basically drop off your loved one and then pick them up at the end of the day.
Oh,
I don't recommend you call it day care, or that sounds not very respectful. So for many of our patients, they feel that they're volunteering. So if someone liked to volunteer, you say, look, you're going to volunteer and help out those patients.
That would be wonderful. How do you know if the people are trained in those facilities?
Well, they are. I think that the wonderful thing is that in our community, there's been a legacy of day programs, and so you can really count on that legacy.
I would think that would just give tremendous relief to somebody. So you have to encourage them, hey, you have to allow somebody else to give you some freedom. So life is not all in isolation. As we get a little bit worse in the middle stage, what are some of the things you find out? What do you see?
What I see is that exhaustion and burnout. So it is important to also seek help. Let's say if you're starting to experience depression, anxiety, sleep problems, to really talk to your primary care doctor about those issues. That is unfortunately extremely common.
Sure.
And then the other thing that actually comes up quite frequently are many times, especially if it's a younger, early onset disease, there is a tremendous loss of income. So there's financial strain at this phase.
I bet that would be, and finances are often strain on every couple. So an added, not planned for, stress would be really very, very difficult for people. So that's the caregiver. What's going on with the patient now as they're advancing in middle stage? What are they doing and not being able to do? And what are the problems?
Well, if you can imagine, there's a loss of initiative, not able to plan one's day. So you take someone who's highly successful and really not able to do much of anything without that initiative of a caregiver. So it's that constant care that is really challenging. And so I encourage time off again.
Can the caregiver say, let's go out for a walk, honey? And are they able to go out for a walk and manage stair steps? And
it depends on the illness.
Yeah, so it depends on how far.
And it depends on the person, too.
Sure. So it depends on their strength and their size and what other problems they've got. I think the best thing is that there are services available for both the caregiver and for the patient. Now, as things get even worse, and this is a progressive illness, and you say the middle stage is usually the longest. So at the end stage, this is where somebody needs full-time care in a nursing home, in an Alzheimer's home, at home with hospice, or what?
So there are a lot of resources available. I really like the option of assisted living, particularly those that have a memory care unit. So that's really important. Is it a locked facility? So in a memory care unit, it doesn't appear like a locked place, but it's one that you don't have the ability to go in and out of freely, because that would be very problemsome if someone was able to walk right out of the building.
Sure.
And the advantage is that it's a low one-on-one staff ratio many times, or very low staff to patient ratio. The other advantage is that there's routine. Remember I talked about how routine is preserving?
Yeah.
The brain loves routine. And guess what? What you might find very constricting in terms of having this very regimented day is actually a relief to patients, to almost learn that routine, to feel comfortable in that environment because there's predictability.
So Monica, what I'm seeing and what I'm hearing is that we start early. There's lots of things you can do. It progresses a little bit. There's lots of things you can do and lots of resources available. You get in the middle phase and you've still got help, and you've still got services available, and you've still got places where people can go and intermingle. And then as things get even more progressive, there's still help for these people.
Absolutely.
I think that's, to me, that's thrilling. To me, that makes goosebumps, really, to be frank with you. So there's always hope, and there's always help for the caregiver, and always for the patient. that right now has this unfortunate problem. I'm waiting for you to get a cure for this illness that's devastating to our society, but you're doing such a good job of helping these people.
Well, thank you, Dr. Overholt.
You're also a great teacher. Thank you for coming to the Dr.
I really
Bob
appreciate
Show.
this chance. Thank you.
Know that Alzheimer's is a disease and that you may have to acknowledge that. And you may have to seek help. Be sure you seek the right help. Be sure it's professional help. Be sure that you know that the caregiver has to take care of themselves and the patient has to be taken care of. And it's all available for you. And it's in our society, and it's here in Knoxville and in East Tennessee. So take advantage of that. Now you're going to want to stay tuned. We're going to be talking about our old friend snoring. There are some new things that we can do to help stop snoring, and also a rotator cuff problems may not need surgery. If we can get that in, we're going to be a genius. A lot of information for you. I want to thank Dr. Monica Crane. Wonderful discussion on once you have the diagnosis of Alzheimer's, what can you do? Remember, there's hope and there's assistance. Now, questions from you, the viewer, that I think will be important to your health. Dr. Bob, my husband snores so loudly that I have to sleep in the other bedroom. What can I do? Well, we know that snoring is because the back of the throat vibrates when we breathe in. There are three things that cause snoring: bad nose, bad throat, and bad belly. And they make us, if we're really loud snorers and we snore every single night loudly, there's a good chance we have obstructive sleep apnea. But what can we do about snoring so we can reestablish relationships? There are lots of things. Number one, fix the nose. If you got a problem with it, be sure it gets fixed. You may have to see an ear, nose, and throat doctor. As far as the throat goes, there are some problems with the uvula in the back of the throat. Those, we'll talk about what we can do about those. It could be changing the position of the jaw and the tummy being too big. So if you lose weight, you'll have less snoring. If you fix the nose, you'll have less snoring. So what can we do about the throat? Well, there are some dental devices that will help pull the jaw forward. So you may talk with your dentist about snoring. Yes, because they know the devices, and there'll be devices that you can get if you have good medical advice that pulls the jaw forward, or maybe makes the tongue where it doesn't fall so back in the back of the throat and cause us to snore. Sleep on your right side. Put a tennis ball, tie it on, sew it onto the back of the shirt, so you'll feel uncomfortable when you're lying on your back. So roll over on the side, and sometimes that snoring will go away, and life will be much, much better. So remember, fix the nose, fix the throat, fix the belly, and watch that snoring stop. Question number 2, Dr. Bob. Does rotator cuff problem always need surgery? That's a good question when we use the word problem, because the rotator cuff is a group of muscles in the shoulder that help move the shoulder. It's one of the most movable joints that we have. As we get older, the muscles that help control that joint sometimes get a little dry. Sometimes there's little bitty tears in there. But that can be helped by physical therapy, leaning over a table, moving your arm, talking with your doctor about alternating heat and cold, and physical therapy with routine activities. Now, if those muscles, if some of those are torn, then if they're torn, it's got to be fixed, especially if it's torn all the way through, because those are the muscles that allow you to do the things: throw a ball, comb your hair, reach out for things. So you may have to have rotator cuff surgery. That surgery is very, very effective. Usually they can do it without having to do a large wound. So they do it arthroscopically. The repair sometimes is slower than the person thinks. It may take up to 4 or 5 months, but you'll end up having a shoulder that's very functional again. So see a professional, physical therapy, ice, ibuprofen, but be careful about ibuprofen because it can bother your stomach. So pay attention to the needs of your shoulder and know that all problems that are rotator problems don't necessarily need surgery. So take care of your shoulder, take care of that snoring. If they're snoring so bad that you get obstructive sleep apnea, then that's where people actually stop breathing. Low oxygen can't nourish the brain. The brain needs more oxygen than any other organ. So if you've got sleep apnea, you need to be sure that you seek professional help. It's all the time that we have for this show. Remember those 4 things that we like. Number 1 is exercise. Can't tell you how much exercise is important to your health. It will reduce stress. It will help you lose weight. You'll perspire and lose some salt. You'll get a runner's high. You'll feel better. But you've got to do it. And you've got to get those tennis shoes and you've got to get out and walk, find some friends, have a good time. Get 7.5 hours of good sleep. We used to say 8 hours, now it's 7.5 hours. Know how to sleep well. Know that the room needs to be nice and dark and comfortable, that the covers need to be nice and fit good. Be sure that you're not taking medicines at nighttime or smoking at nighttime that will keep you from sleeping well. Eat properly. Eat good food. You know what good food is. Eat small portions and enjoy eating on a regular basis. Don't avoid eating. And most of all, what is it we like on the Dr. Bob Show? You know, it's that laughter in your life. How fun is life when you laugh and the people around you laugh? You'll be more productive, you'll be happier, and you will be healthier.